Hi there, I'm Dr. Cody Gordon. I'm a Calgary-based upper cervical chiropractor. I've been practicing in the city of Calgary for about 20 years. I'm going to talk to you a little bit today about upper cervical chiropractic. People often ask me, what is that? Does that mean you deal with the upper neck only? That's not what it means. It means that the upper neck is a strong focus of mine. And why is that? That's because although you have an entire spine that needs attention, anatomically speaking, the upper neck is very unique. Its ability to support the weight of the head and allow the mobility of the head and neck in ways that the rest of your spine just doesn't allow. By far more mobility in the upper neck than there is in any other part of the spine. And so that's one reason that we focus on it. Anatomically, that's why we focus on it. But neurologically, we focus on the upper neck because all of the information that your brain wants to send to your body has to pass through the upper cervical spine. And all of the information from your body going back to the brain also has to pass through that narrow window. And so anatomically and neurologically speaking, it's an extremely important part of the body. And because it is so unique, it needs to be addressed specifically and uniquely. The way that you adjust the first vertebra in a person's spinal column is very different than the way you would adjust the seventh vertebra or the first lumbar vertebra. It just is, and it should be handled in its own unique sort of a way. And so that's what I do in my practice. We'll always look at the upper neck using digital radiography to map out the position of the structures in there to make sure that we know exactly where things are starting from and that we can address an adjustment that's going to correct the mobility of the upper neck to its best degree possible. I wanted to address the condition of vertigo today. Specifically, what we want to talk about is cervicogenic vertigo. It's a specific kind of vertigo. Cervical means spine, so it means a neck-generated dizziness or cervical spine-generated vertigo. Although that is a specific thing, I believe that a lot of people that suffer from vertigo at least have a component of their vertigo that is coming from their upper neck and their cervical spine in general. And we'll talk a little bit about how that comes to be. Now, people can have inner ear problems and other issues. I believe that a lot of those issues often have an association with a misalignment in an upper neck as well. But we'll leave that and speak specifically about cervicogenic vertigo. Now, just for simplicity of this conversation, we're not having a long video. We're going to talk about what goes on in the joints of the vertebra in your spine. There's a couple of very important signals that the brain receives from the spinal joints. And the upper neck or the upper cervical joint complex, your base of your skull, your first vertebra and your second vertebra, they are extremely densely populated with nerve endings that feed back a couple of very important signals to the brain. And they're more densely populated with these nerve endings by far than any other vertebra segment of the spine. The signal that tells your brain that you're moving and that the movement is healthy and comfortable, we call that signal proprioception. It's a non-conscious awareness of your body's position in space. And that signal comes from a spinal joint, and it comes to a part at the back of the brain called the cerebellum. And the cerebellum deals with posture, balance, stability. But that proprioceptive input to the cerebellum is very desired by the brain. And when it gets lots of feedback stimuli saying, I'm moving and I'm healthy with this movement, it'll feed that forward to different parts of the brain, and they will determine the neurochemicals that are going to be propagated to continue to allow you to do this movement. Neurochemicals like serotonin that will keep you motivated to do the thing that you're doing that is giving the brain the stimuli input that it wants to get. So we're upping the proprioception. The other signal that those spinal joints can send is when they're not happy about their position. So they can be misaligned in a dynamic way. So they're moving, but they're not moving in a healthy way. And they can be misaligned in a fixated way, meaning they're restricted. They have very little range of motion. And then a signal goes to the brain, and that signal is called nociception. And nociception is an awareness that we are not happy with the thing. Now, understand that I didn't say pain, because nociception is not pain until it reaches the frontal cortex. That's the area that you're aware of. So nociception is like non-conscious pain. When your brain receives nociceptive signals, it deals with them in the same way that you would deal with pain if it reached your cortex. It's just not at that level. But all of the same things are going to happen. So vasoconstriction, increased stress hormones, catecholamines, cortisol, breakdown hormones that help you in fight or flight types of things. All of these things get generated by your brain's receiving of those nociceptive signals, even though you're almost completely unaware that that is happening. But now you're in a breakdown process, right? We're in a stress process, and this isn't a healthy place to be. So we want to change that one. We want to increase the proprioception. Now these signals also exist in are inhibitory to one another. So if you can raise your proprioception, you will inhibit or decrease your nociception. But unfortunately, if you can increase the nociception, you will decrease the proprioception. So your brain receives less proprioceptive input when there's high nociception, and therefore produces less of those feel-good neurotransmitters like serotonin and things like that will keep you motivated and doing things. So you can literally go into a depressed state. Why are you depressed? I don't know why I'm depressed. Well, you're in silent pain. You're in pain that has not yet reached your cortex. And so you're kind of dealing with this problem, but you're not consciously aware of it. So those are some of the things that drive these processes. And remember what I said about the cerebellum coordinates balance. It coordinates body control, muscle tone of extensors and how you stand up and regulate your posture. These things are controlled in the cerebellum. And so if we start increasing the nociception and decreasing the proprioception, this is a really likely way that we're going to start to create pathologies of balance and control. And that's what you would have with a cervicogenic vertigo. So people often come to see me with those types of conditions. The correction I do with the upper neck is very gentle. Although I'm adjusting the upper neck, it is not a random manipulation. It's a very specific moving from point B back to point A, so to speak, type of an adjustment. But is done with a gentle hand adjustment to the upper neck. There's no popping or cracking or things that people sometimes are concerned about. And after I adjust somebody for the first time, remember I had mentioned that we take a picture, we take an X-ray image to map out the misalignment. Well, I'll take an X-ray image after the first adjustment to ensure that the correction was as complete as possible. And then going forward, we know that we have good confidence in the work that we've done, and we can do the same thing over and over, and we can continue to correct the problem and work it down. I hope that's given you a little bit of information that's useful. And if you would like to give our office a call, you can always schedule a free telephone consultation with myself. I can talk to you about any of the other issues that we deal with, or if you wanted more information about cervicogenic vertigo, I'd be happy to talk to you about that one. Okay, until next time, people, take care. Keep your head on straight.